Hi, I'm Michael and welcome to California. Over the last month or so, Californians have been hit with a wave of shutdowns, lockdowns, and forced closures of non-essential businesses to help prevent the spread of the coronavirus. Unfortunately, these necessary measures have affected a huge part of the California workforce, and we in California are seeing an unprecedented level of layoffs, furloughs, and forced times off. As a result, the number of people applying for unemployment benefits have skyrocketed, and there are even more to come. So today, we're going to discuss what are your health insurance options if you are no longer able to get health insurance through your work. Luckily, here in California, there's a lot of health insurance options for those of you trying to get health insurance coverage in these uncertain times, especially when living life uncovered could put your economics, your health, and your family at massive risk. Not to mention that there's still a tax penalty of a minimum of $695 for Californians who don't have health insurance coverage. So whether you lost your health insurance through your work or still just haven't gotten coverage but need to, this episode is going to be for you. So first, let's talk about Covered California. Covered California is a state-based health exchange that provides Californians with monthly assistance paying for their private health insurance plans. It is not Medi-Cal. It is possible to apply for Medi-Cal through Covered California, but Covered California plans are private health insurance plans similar to the ones you may have gotten through your work, like Blue Shield or Kaiser or Molina or Healthnet or most major health insurance companies. But the difference with a Covered California plan is that you can get an extra premium assistance to help you pay for your monthly cost. Another great thing about Covered California plans is that nobody can be denied because of pre-existing health conditions. So whatever your health condition is, you can still get coverage. Second, Covered California was specifically designed for people who lost their health insurance, either temporarily or permanently. By this I mean that plans can be enrolled anytime throughout the year whenever someone loses their health insurance. Additionally, Covered California plans can be canceled at any time. So for example, if you're losing your previous health insurance but are starting a new job, and your new job's insurance doesn't start for 90 days, then you can still enroll to a Covered California plan for those 90 days and cancel whenever your new work insurance starts. Another example could be that because of temporary furlough or drop in hours, you may not be eligible for health insurance for the following quarter at your work. In this case, you can still enroll into a Covered California plan for just those 3 months you need the coverage and cancel once you become eligible for your work insurance again. Now, this doesn't mean that Covered California is only for temporary coverage. These plans can be used as permanent insurance as well. There is no time limit that you can have a Covered California plan, and they renew every single year. So in that sense, they're useful for temporary coverage or for permanent coverage. So now let's talk about who's eligible for a Covered California plan. There's a lot of misnomers about who can and who cannot get insured through Covered California. The eligibility for Covered California plans are based on a variety of things. First, in order to apply, a person must be a resident of California and have lawful presence in the United States. So you gotta live in California. But if you do live in California but don't have lawful presence in the United States, you're still able to apply for some health insurance carriers directly, but not through Covered California. And these direct plans are not eligible for monthly premium assistance, so you will have to pay 100% of those costs. Now, if you're looking for insurance plans that do not require legal presence, we will cover that in a future video. So first, you have to live in California. Second, you have to have lawful presence in the United States. And third, you must be within 60 days of a life change that caused you to lose your health insurance. These 60 days are called special enrollment period. These life changes can be things like had a baby, or moved, or lost coverage with your parents, got married, or the one most relevant to today's video is you lost eligibility from your work insurance. Within these 60 days, you have an opportunity to enroll into a plan, but if you miss the enrollment window, you have to wait till next year to enroll. Another one of the most important questions I get asked when helping somebody enroll is, how much does it cost? And in fact, it's really the main question that anybody wants to know. And the answer is that it changes from person to person. The cost of a plan through Covered California are based on 4 main factors: age, income, household size, and zip code. And based on these factors, everybody who has the same age has the same plan cost, but what varies is a person's income, household size, and zip code. These factors really can change the cost of a plan for someone applying for CCA, but generally, the more you make, the more you'll pay, and the less you make, the less you'll pay. So let's change perspective and look at a couple examples of CCA plans. Alright everybody, hi. So I wanted to get a chance to do a brief kind of overview of how subsidy interacts with plans through Covered California. And this is just going to be a simple example of a household, a common household here in Southern California and how they could technically apply for Covered California and get subsidy and how that would apply to their account. So first, this is going to be, like I said, a household of 4 people, and their income's going to be $70,000, which you can see here. They're located here in Southern California, and the ages of the household members is 50, 45, 19, and 14. So like I said, Covered California bases a person's subsidy on age, income, household size, and zip code. And so we've got all 4 of those things put into the calculator. And so when we look at Covered California, there's a couple of things that are really important when you're looking at plans. And again, this is just a brief overview, but it'll be a good opportunity to kind of see how that subsidy works. But basically, Covered California has 4 levels of plans. It has a bronze, a silver, a gold, and a platinum. And the gold and the platinum are really ideal for folks who have major health issues, people who have a lot of expenses that they're planning to do, or they just want to have really, really good coverage, but they are usually pretty expensive. And so the silver and the bronze are a little bit more basic plans. The bronze is the most basic and also least expensive, and the silver is kind of the middle of the road of the cost as well as the middle of the road of the benefits. And it's also the most popular plan. So when we're looking at the plans that just came up here, we'll look at the silver level plans. And silver level plans are silver level plans in Covered California. And by that I mean that the benefits are exactly the same regardless of which plan someone looks at. So whether it's Healthnet or Molina or Blue Shield or Kaiser or Sharp or whomever it is, the benefits are exactly the same. So that does not change. Now the cost is going to change because the cost of the plan is actually more expensive or less expensive, but the benefits don't change and the subsidy doesn't change. So in this case, we can see here of a person who's a household of 4 who are 50 and 45 and 19 and 14, and their income is $70,000. They live here in Southern California. The amount of subsidy that they're eligible for is $945.75. And that is a combination of both federal and state subsidies. And that subsidy is applied to whichever plan somebody would want to choose. So whether they choose a Healthnet plan or a Blue Shield plan or the other plans, it applies to all the different plans equally. So that's not going to change. The only thing that would change that is someone's demographic information. So your household size, your income. And the important thing with income is that it is dollar for dollar. So if your income goes up like $5 or $10 or $1,000, it's going to have an effect on how much subsidy you're eligible to get. So in this example, if we look at Healthnet, the actual cost of the plan is $1,387.20. And so that would be the same as if you went to Healthnet and said, I want this plan. You can get that plan, exactly the same plan. But the difference is that the federal government's going to kick in $907.23 for this family, and the state government's going to kick in $38.52, bringing that total down to $441.45. So this is the amount that they're actually going to have to pay every month. This is the actual total cost, and then these are the subsidies that are eligible because of their income in their household and those kinds of things. And like I said, these subsidies are exactly the same, so they don't change from plan to plan. It's just that the actual cost of the plan differs. So if we looked at a Blue Shield PPO plan, you can see here that the actual cost of the plan is $2,175.73. The subsidy stays the same because that, again, is based off their age, income, household size, and location. So that's not going to change. But it means that if they choose this plan, it's still a silver level plan, so the benefits are the same, but the actual cost of the plan is much higher. And so even though the same amount of subsidy is added, the total cost of the plan is still going to be much higher than if they had chose the Healthnet. And the other thing that's important is that these plan benefits, they change every year. The costs change every year. So not every year is Blue Shield the most expensive, or Healthnet the least expensive, or Molina in the middle, or Sharp, or whatever. Those things will change every year, and that's why it's very important to look every year at what those plan costs are and make sure that they fit what your budget is as well as what your needs are. And so there are other plans. There's gold, there's bronze, there's also platinum, and we'll go over those in a future video, but this example is just really meant to show how that subsidy interplays with the actual cost of a plan and give you an example of what an average household looks like, and what that cost could be. So with that, let's get back to the video. All right, so lastly, let's talk about income. So Covered California bases how much monthly premium assistance you can get on the 4 factors I mentioned earlier. One of the biggest factors of the 4 is income. And this can be a bit tricky because everyone's income situations are different. Also, I want to preface this section by saying that I am not a tax preparer. I'm not a CPA, I'm not even really that good with numbers. So if you have any specific questions about your income and Magi, please reach out to your tax professional and they can give you better guidance for your specific situation. So that being said, Covered California uses something called a modified adjusted gross income to calculate your subsidy, or Magi. This uses your taxable income as well as things that are not included on your taxes but are included for the purposes of eligibility for premium assistance. Some of these things that are counted are hourly earnings and bonuses, unemployment benefits, SSDI, Social Security, and a variety of other things that may not be on your taxes but should be included for the purposes of calculating your Covered California subsidy. So here is a handy form that we use put out by UC Berkeley that gives an overview of what should or should not be included in Magi income. The important thing to remember here is that Covered California is asking you to make an estimation of your income for the year 2020. That's this year. That means if your income is going to be different this year from last year, 2019, you'll need to make an estimation of what you think your income will be for 2020. That includes any money you've already made so far, plus any unemployment benefits, and any income from spouses or children or dependents or anyone who'll be on your taxes, even if those household members are not applying for insurance. If they're on your tax, then we generally want to include their income. And again, this is just a brief overview of income, but we will save the in-depth income requirements for future videos. So I hope that you got some of your questions about getting health insurance answered today in this video. I know that the whole process can be confusing and frustrating and sometimes just plain hard, especially coupled with all the other things that may be going on in your life right now. That is why we here at California are here to help. We are certified Covered California enrollment entities, and we can assist you through all the steps of the process of enrollment. In addition to getting you enrolled, we're available year-round to help you submit documents, make updates to your existing Covered California accounts, get tax forms like 1095As, and help you renew your plans when it comes time. So if you need to enroll or have general questions, feel free to reach out to us and we can make some new videos or post answers to your general questions. But if you want more specific help, you can always contact us at the information on the screen and we can walk you through the whole process of enrollment in English or in Spanish. So please don't forget to like and subscribe to get updates when our newest and most informative videos become available. So for California, this is Michael wishing you a happy, healthy day.